My name is Sarah Moreau, board-certified behavior analyst and family nurse practitioner, and I'm here with the wonderful Kristine Dixon, also board-certified behavior analyst and advocate.
Yes.
And of course, the one that I'm really distracted by is Miss Reese, this beautiful girl who has joined us today to talk about self-care.
And puppy power. Yes. Well, 15 years in the field, I've really learned that self-care is vital to helping other people, and that the breaks are just as important as the active work.
It's very true.
Yeah. I think when you first become certified, I struggled with the balance. Did you?
Absolutely. I failed at the balance. I think I did.
What did that look like?
Yeah, I mean, I would go home thinking about clients. I would wake up at night thinking about clients. I would not necessarily identify my circle of influence and what I could actually accomplish in a day. And I would really beat myself up over it when it wasn't working the way that I thought it should. Yeah, I think that it was really stressful at the start.
It can be, for sure.
And an interesting thing about the Nursing Ethical Board is that in that code is the nurse must take care of themselves.
I love that.
Yeah, and I don't know, correct me if I'm wrong, do we discuss that beyond, transitioning in and out of cases, like our own self-care as behavior analysts?
Yes, it is definitely in our code that you have to be competent. You have to report certain things to the board.
But
you have to.
Is there language about you have to take care of yourself and be well?
I don't think that exact language is in there, but it should be.
I think it's important. It's definitely part of nursing. And when I saw that, I was like, oh, wow, that would be cool. Because I could have really used that when I was starting as a behavior analyst.
Healthy habits, it's important. This is the structure that allows you to be vital.
Absolutely.
Have vitality in life.
And to make a difference for other people. I think it's really crucial. So some of the things that I like to do for self-care, I love to jog and hike and be outside. And look at this beautiful view we have here.
Yeah, we're bathing in nature bathing as behavior analysts. And it really does. There is actually scientific research that says, hey, patients in the hospital that were looking at nature had better outcomes, right?
That's true.
Those that were not.
Mm-hmm.
And so nature can be really restorative.
It can be.
And relaxing.
Yeah. Having that connection is really, I think, an important part of being healthy. But Reese,
I know. She's comfortable.
She is just a wonderful dog, and we are both dog lovers. And I'm so grateful, Reese, that you could join us today.
What are your thoughts on self-care? It's very important to take naps throughout the day.
That's right.
And it is good. Sleep is important, right?
Sleep is very important.
It's important for dogs. It's important for people to keep us vital and healthy.
That's true. And, there used to be, I think, this emphasis on I work really hard. Yes, Reese, I agree with that. I work really hard and I don't sleep that often, and that makes me really great. And no, it doesn't.
No,
actually, it makes you not great.
And maybe grouchy.
Yeah.
And maybe short-tempered.
Yeah. Your brain needs to repair and clean itself during sleep. And if you're getting not enough sleep, you're not living up to your best potential.
I agree. So exercise,
sleep,
part of self-care,
nature, drawing boundaries.
Yes, healthy boundaries. That is such an important theme, as to when you're going to engage, when you're not going to engage with clients, what work time versus leisure time, defining those really throughout the work week.
Yeah.
And then taking breaks, going on vacation, seeing friends, family, being with others.
Yeah.
Not doing work.
Being with your dog.
What do you think, Reese? Huh? It's like, yeah, it's good to relax in nature, I think is what Reese is saying right now. And pets. Pets are very reinforcing. Right? Yeah, a lot of people have to be taught how to take care of themselves. Right? Like, drinking water. Yep. Very important. Dehydration leads to, some real problems.
That's true.
You can become dizzy and
Mhm.
yeah, lots of issues if you're dehydrated. The important thing, just like Reese is showing here, is this full relaxation when you're not working. Now you have 2 dogs.
I do have 2 dogs, and a husband, not ranked in any particular order. Um, but spending time with the dogs and with my husband is a really important part of my life outside of my work. And I think it just makes me better
Yeah.
than to go into work, to be able to have that respite time for myself.
And I think you're right. The mindset really was, and it was for our generation, was work hard, play hard.
Mm-hmm.
Work hard, get ahead.
Yeah,
That rat race mentality that was really, it was so strong in the 80s.
really was.
It really dominated the US culture. But now I think, the pendulum has swung the other way. We're definitely more into self-care, into healthy habits, taking care of ourselves. Um, so from a nurse practitioner, what makes people run down
Yeah.
and what makes people have vitality?
Yeah. So we have already talked quite a bit about healthy habits, but certainly, eating well, sleeping well, getting exercise, engaging in good social relationships. Those are all really very beneficial for your health, for your well being, for your ability to function well in your work, whatever that may be. Um, I think some of the things that run people down are maybe not great coping mechanisms. So, maybe drinking too much or smoking or engaging in things that are not healthy but help you in the moment to feel less stress. Um, those aren't great stress coping mechanisms. And those are things that are going to catch up with you and eventually make you feel run down. We talked about hydration, how important that is. Healthy foods, making sure that we're getting enough fiber and we're eating enough fruits and vegetables and healthy proteins. Um, Reese, I thought you'd be interested in the food
Don't fall
component.
asleep during Sarah's talk.
She's so cute.
She's like, I cannot.
Oh, she's so tired.
She's like, it's nap time.
Yeah. But yes, getting rest, Reese, very important. I also really think it's important to get your vaccinations and get your regular visits with your healthcare team. Get your screenings because it's always easier to treat something early if there is something that's out of order and that needs to be attended to.
Yeah.
Yeah.
And I think when you're first starting out, another part of self-care is acknowledging that you're not going to be perfect.
Yeah.
When you
don't know
begin.
everything.
You don't know
I
anything.
still don't know everything.
Yes. You don't know everything. Things are not going to be perfect textbooks. There are going to be a lot of confounding and extraneous variables that you'll have to address and look at. And that's part of the job.
It is. And it's not maybe some things that you are encountering you haven't talked about or even heard about before. So it's always great to have those mentor relationships, people you can reach out to and say, hey, what should I do here? Especially in those early years, when you're being encountered with all kinds of different experiences. You may not have a family of your own. You may not have experienced these relationship issues that we see sometimes in the households that we work in. So having people that you can reach out to and speak to, really important support.
And recognizing that as a behavior analyst, you are working in mental health, which means sometimes people aren't happy.
That's right.
They're not happy with their lives, their circumstances, their child, the contingencies, what the school said, what the doctor's telling them, and you have to really actively listen and not judge.
That's right.
Yeah, be very open-minded,
Yeah.
Yeah.
And making space for people to speak about their experience without feeling like you have to jump in and solve it right away. I think that is a skill that's important to learn when you start, because then that way you're giving them a chance not only to speak and be heard, but you're giving yourself a chance to really take in the information and consider what should be done before trying to take action.
Yeah. And then recognizing as well that there is a boundary of professionalism and psychological safety that you as a behavior analyst are entitled to. Not only are you entitled to all the employee laws and things, your breaks and things like that are lawful compliance, you're entitled to psychological safety. And it's okay when people cross that line to have that, oh, hell no boundary, where it's like, and you don't necessarily have to say, oh, hell no, but you need to recognize when, it's not psychologically healthy when someone's really lashing out. And maybe with experience, you're able to take that on more and not be judgmental of it and not really process it, identify with the lashing out. But there's also times when we've seen clients cross a line and we've had to step in and say, oh, I'm so sorry, but you can't do that because it's making our team feel unsafe or.
Yeah.
And those boundaries are so important because if you do not set those boundaries, people will cross them. Clients will cross them, vitally important. Those boundaries give us structure.
Yes.
And
they keep us safe.
Yeah. Psychological safety as well. One thing with the elections always coming up is that people at this time naturally want to speak about politics.
Yes.
And we don't speak about politics when we're at work. Yeah.
No.
We just pretend like they don't exist because really we don't want the variable of politics in our treatments.
Yeah.
Right?
Yeah. It's just not that type of relationship.
Yeah.
We're there to help them with their, whatever behavioral problem that we're working on. And that's it.
Yeah.
Yeah.
But people will judge you based on your political beliefs. And so you don't want to bring that into the treatment as part of your identity. You really want to bring a high level of professionalism that doesn't necessarily disclose a lot of personal information about you because, people might not necessarily agree and they don't have to agree. Bringing religion into your personal beliefs in religion, into treatment.
Danger.
Yeah, it can be very dangerous because there's a high probability that you're not going to have the same exact beliefs as your client. And that's just an additional conflict that maybe does not need to be there.
Agreed.
Now, I'm not saying not integrating the client's religious beliefs. We have done that. We've, for instance, integrated like praying for a coping mechanism. It's like it worked.
And it's part of their family culture.
Yeah. But you really want to come in and you don't want to bring the fact that you just broke up with your boyfriend in this session. If you just broke up with your boyfriend or your spouse and you're not emotionally regulated and then you shouldn't go to work that day.
Yeah.
You have to be in a good, centered, grounded place to do this type of work.
Yes, because when you enter someone's home, it's not about you.
And that's hard. That's really hard sometimes for the trainees who want to be behavior analysts and some of the professionals just entering the field.
Yeah.
While I respect your autonomy and your authenticity and you can express that, in this moment, it's not about you. It's about the client or the consumer or the patient or the learner, however you tack that situation. And that's really hard for people.
It is hard.
Yeah.
Yeah.
There's nothing worse than when a behavior therapist comes into a session and starts complaining about their own life to the client because that's not our role. Our role is to lift up the client, Our role is to reinforce and to not bring more problems to the table. We're trying to get the problems off the table, and you laugh, but it's really true.
It's
like
true.
If you have problems in the morning, getting through the morning routine, and you have problems after school, and you have problems at bedtime, well, that's a really challenging day for anyone,
The person who's coming in to help you shouldn't be bringing in additional problems.
Yeah. Now, sometimes it happens, like I got a flat tire on the way here or, it happens, but we should work really hard to try to eliminate that and come in with as a grounded professional clinician. I'm not going to force my religion, my views, my politics, on you.
Yeah.
And then there's the boundary. It's like you also need to build rapport
Mhm.
in self-care with your clients. So what do you choose to share? Well, common interests, right? That's what Piers tells us, right? So what common interests do you share with your clients?
Yeah, so sports or different activities that we both enjoy. Um, Animals, certainly. Many of us love dogs. I know I do, and so does Kristine.
Wait, come on, stay with me. This is a very important and thrilling topic.
She's so bored with us.
She's a
Yeah.
cuddler.
Yeah, but like neutral things that you can share. I know some trainees can share with their families that they're in school, that they're growing, they're learning. Um, I think that those are all fine things to share with clients. But we don't want to share personal things, and we don't want to stress out our families. Which we have amazing therapists. I'm so grateful to be working with so many of the people in our company. Um, so shout out to all of them.
And sometimes we have to communicate things to our clients that are unpleasant.
Mhm.
And sometimes it's really looking at, well, what's the timing of that going to look like
Mhm.
for them? And putting some insights and considerations into that. But boundaries are so important for self-care. They really
Yeah.
are.
And it can be challenging for these younger people who come into someone's home. The family's at home and they're in their home. And there's, I think it can be difficult at the start to know how to withhold those boundaries when you're in their personal space.
Absolutely.
Yeah.
Because there's so many different cultures, at least in
Mhm.
San Bernardino and Los Angeles counties. We have a very diverse workforce,
Yeah.
and that's to serve a very diverse population because, um, finding that cultural match between the client and the therapist is vital
Mhm.
because they're speaking the same language.
Yeah.
Sometimes literally
Yeah.
is so important,
It
right?
is so important.
So a big part of our mission, of course, is to serve the greater communities of Los Angeles. And these faces, cultures, languages are all very different.
Mhm.
And so, getting to know, having cultural awareness, looking at cultural diversity, doing things as a person to garner experience in the different cultures or of the world is really important.
Yeah.
Yeah.
Yeah, I think understanding where you came from and what your own culture is really important as well. And, keeping in mind that when you come into someone's home that they may not have the same background as you and to really emphasize what they want and what their culture works, within the in the program. I think that's really important as well.
Yeah. I have to admit, I do use ABA on this dog. And look at her. She's very relaxed,
It's a
happy, and
very good
engaged,
girl.
right? So,
Yeah.
important. But boundaries are also important. Yes. And children need boundaries.
Yeah.
They really do. One thing that I think is crucial is that kids love to cuddle and they want to
Mhm.
sit on your lap and they want to be really close like your dog and and get that warmth and that affection and um really we need to teach that as, oh no, I need boundary space.
Yeah. Yeah.
Because kids should be doing that with family, so I think it's
Mhm.
important family versus friend
Mhm.
behaviors, but we really don't want our therapists
No.
allowing clients to sit on laps and get, like, emotionally close in that way,
Yeah.
physically close.
And redirecting to a high five or a fist bump, I think, is a really good way to give that child the attention that they're seeking, but in a way that's appropriate for the relationship.
Yeah.
Yeah.
And you also, like, you wouldn't know it now, but 15 years ago, like I've had a lot of clients over time like sort of flirt with me and hit on me and like I had to shut that down. That's a really important boundary.
Yeah.
You cannot say those things to me. I will not stay here. This is my role
Mhm.
in your home
Mhm.
and it's got to be very clear this cannot happen again. So
Yeah.
having that difficult conversation um can sometimes it's necessary setting those boundaries when you're setting boundaries with client. I always say, make sure it's the right time to speak to them.
Mhm.
Do you have a few moments? Is this a good time? Those are crucial questions.
Mhm.
Having the conversation at the wrong time will get you the wrong answer.
Yeah.
It's like, you know, be like, Kevin, which is my husband's name, like, can we talk about, this important dining room decision during the Super Bowl? He'd be like, hell no, not appropriate time, like, so it's the same thing with clients. Saying, do you have a moment? And then directly addressing it. Don't beat around the bush.
Yeah.
I think we've really seen that over time with clients setting boundary or, clinicians setting boundaries that beat around the bush. Like, when you said that, well, yeah, and it kind of made me feel, and I was just thinking that, and maybe we should. It's like, no, don't do that.
Really
You got to
straightforward.
You got to be respectful, but use direct language and say, you cannot say this to me. It made me feel uncomfortable. It's not my role here, and we can't have it continue. And if it does continue, I can't be the clinician working with you. So setting those boundaries is crucial.
Yeah.
For your own psychological safety. And that's really what it's about as well. Psychological safety. So healthy boundaries, so important, as well as boundaries in terms of when you get up. So you go to work.
Yeah.
When you go to sleep, because you need sleep to function. Also in terms of leisure time and when you're going to consume and, if you do drink alcohol, no judgment, but like, are you going to be safe about it? And how, are you going to have a driver that's sober? And are you considering safety skills? So all those things, very crucial.
Yeah. Because, a lot of your life sets the stage for how you're going to be able to work with others.
Yeah. And you have to be strong, both physically, mentally, to be able to be a phenomenal behavior analyst. You really do.
Recommend having a dog.
And dogs help so much. That's the greatest variable. Other things that I think can help set healthy boundaries is communicating how you like to be communicated with. Like, I like phone calls. Some people only like texts. Like, some people want written emails. So learning the communication styles of others.
Yeah, that is really important. Not only with clients, but coworkers, really everyone that you interact with.
Yeah. And then I also think not sweating the small stuff. You can really get wrapped up in mistakes when you're taking such massive action towards goals. And ABA is goal-driven, right?
Yeah.
So we're working towards goals. Goals set by the parents, goals set by yourself. You as a behavior analyst also have tons of professional goals that you need to meet on a monthly basis. You have to do CEUs. You have to continue your education. You have to do the paperwork. There's a lot of goals. But I think it's also good to look at what's realistic and what's not and be really honest about that. I've definitely had coworkers that had unhealthy boundaries and drove me mad, like calling at 9:00 at night.
And what that shows me is that employee is having a hard time shutting off their work at the end of the day. They're still thinking about it at 9. So now they're reaching out to you.
Yeah. And also shutting down clients. I rarely take clients' calls after 9:00. I do oversee the practice, so I will take calls up into them, or I will follow up on the parent phone calls during the day. But after 9, no. On Sundays, maybe to 12, maybe 2, then I just cut it off.
Yeah.
And those are really important boundaries to say, nope, this is where I'm going to read and, clean my room and do laundry, like other important factors. So carving that out. When we were early on and we were just driving around everywhere before even telehealth, like I would just eat horrible. I would just do drive-thrus.
I did too. Yeah.
That wasn't very healthy. I would just drive through because I'd be like, I have 15 minutes. What am I going to eat? Skittles and a Diet Coke. Like, okay, next. All right. Like, I got 30 minutes. What am I going to eat for dinner? I'll play a local. Let's do it. It's like, did you have a hard time with that?
I did a lot of driving through fast food early on. I feel like I got better with packing good food when I was working as a nurse in the hospital on the floor, because you have a 12-hour shift. You get a 30-minute break, usually after about 8 hours of work. And that's all you get. And if there's an emergency, you got to get back there. So I would pack things that I could eat really quickly, but that were super healthy, like protein dense foods. And I'd really like plan it out. So that helped me, I think, to kind of shift my thinking and how to prepare for the week. Um, but the allure of drive-through when you're driving around, it's pretty hard, to keep yourself on a healthy track because that salad doesn't look as good, you know, after you've been driving by Taco Bell all day.
And time management, it's a part of self-care. People don't realize it, but like
Yeah.
planning, you can't accomplish anything without planning.
Yeah.
Like, you will hit the obstacles and the challenges when you're building anything, but planning is key.
Yeah.
Important part of self-care.
Yeah, makes it easier for you down the line, for sure.
And then I think the biggest part of self-care is community.
Mm-hmm. Yeah, investing in healthy relationships. Very important.
And that's one of the things that we've learned through Peers, which is the social skills program out of UCLA, Elizabeth Lageson and Fred Frankel. Science of Making Friends, just life-changing, that research. And, it really talks about meaningful friendships and, what that looks like with people that you have close to you.
Yeah. Yeah, really helpful identifying healthy relationships and what those things look like, and identifying when maybe things aren't as healthy as they could be. I don't know that all of us have really great models in our life as to what are really healthy friendships, really healthy relationships. So that program was really helpful, I think, to identify those factors.
Yeah. Like even just the role of humor, when you are the joke, when that humor is pinpointed to you, you really have to look at, like, is this a meaningful relationship? And that's important. That's important for self-care. But sleep, water, good food, time management, having community,
Coping with stress.
setting healthy boundaries, doing it in a direct way, unapologetically of what you need for psychological safety.
Yeah.
And then, the leisure skills, the relaxing, the nature bathing, which we're doing today.
Yes.
Reese's doing it. She's like, in nature, I'm very relaxed. Yeah. I think it's so important. Yeah. So that's what it looks like for us as behavior analysts. Self-care.
Self-care.
Yeah. But what does it look like for you? Let us know. Comment, subscribe, engage. Tell us we're wrong. Tell us we're right.